Are you starting to notice that hip pain that once was just kind of a slight bother occasionally is becoming more and more prevalent? Maybe it's affecting you when you lie down on that side or when you're sitting in the car for a long time. Maybe you're trying to train for an upcoming race and it's starting to put a burden on your training plan there. I'm Dr. Gage Winkles. I'm a sports chiropractor here at Health Fit Chiropractic in Boca Raton, Florida. And today I'm going to talk to you about a condition that I do see come into the office misdiagnosed fairly often, and that is Greater Trochanteric Bursitis. Oftentimes this is classified as hip bursitis, and what that is it's often pain over the lateral portion of the thigh here. If you feel on the outside of your thigh, you might feel a bony prominence there, and it can be pretty painful around that area. There might be some residual swelling there. And that is the bursitis there. So we have bursa sacs, which are small sacs of fluid that can become irritated and inflamed from various causes. And what we need to do is we need to work to get those to calm down, get our muscles in the surrounding area to be able to function properly. We need to make sure our joints in the surrounding area are functioning properly. And that will help us get back on track for maybe that race that's upcoming. What that looks like here in the office is we need to do a thorough assessment. We need to make sure that we are dealing with Greater Trochanteric Bursitis and not another condition that may mimic that. And then we need to start in our phase one of care of making sure that we decrease that pain and inflammation. A lot of times we'll do that with our shockwave therapy. Once that pain has decreased and that inflammation has decreased because the shockwave has dampened that inflammatory pathway, then we work into phase two of care here, which is where we start to rebuild and repair that tissue. There we're going to come to our rehab space here. We might utilize one of the machines behind me here, the TRX cables. We might go ahead and start to strengthen out the glutes, the TFL, and even some of the quadriceps here. What that's going to do is that's going to help us offload the pressure that's going to specific muscles that attach right off of that bony point of the hip there. Once we've gotten that area calmed down, we've started some exercise and things are starting to look up, then we can start to send you home with some exercise there. So that way, if this condition starts to creep back in further down the road, you're able to use some tools at your own disposal before you have to come into the office here. If you have any questions about Greater Trochanteric Bursitis or hip bursitis, maybe you want to see if shockwave therapy would be a good fit for you to help calm down that area and start healing, give us a call here at 561-997-8898. I look forward to seeing you guys later. Take care.